Hey there again, it's Dr. Charles Modlin, your friendly urologist, with you for another health equity brief. Again, these health equity briefs are an opportunity for me to convey to you, the listening audience, and hopefully you'll spread this word to others about important health topics that I think are important for you to maintain your health and improve your health and that of your family and community. The subject for today's health equity brief is on glaucoma. Now, after cataracts, glaucoma is the leading cause of blindness among African American populations, who are 6 to 8 times more likely to get the disease of glaucoma. Now, what is glaucoma? Glaucoma is a chronic progressive eye disease caused by damage to the optic nerve, which leads to visual field loss. One of the major risk factors is increased eye pressure. An abnormality in the eye's drainage system can lead to fluid buildup, leading to excessive pressure that causes damage to the optic nerve, again detected by measurement of the eye pressure. Some more information: glaucoma can happen at any age, but is more common in older adults. Again, it's one of the leading causes of blindness for people over the age of 60. Many forms of glaucoma have no warning signs. The effect is so gradual that the individual may not notice a change in their vision until the condition is in its later stages. Again, this just underscores the importance for everyone to undergo routine eye exams with an ophthalmologist. It's estimated that 3 million Americans have glaucoma, but only half know that they have the disease. Everyone is at risk for glaucoma. And again, I'm going to repeat myself, there may be no signs or warning symptoms. More specifically about glaucoma in African Americans. African Americans, again, experience higher rates of glaucoma compared to white individuals, again, up to 6 to 8 times more likely to develop glaucoma in African Americans, again, often at a younger age. And African Americans are at a considerably higher risk of blindness from glaucoma due to its faster progression in the African American population. This disparity is attributed to a combination of genetic factors specific to African descent and potential disparities in access to health care. If you don't have access to health care, that correlates not having access in most situations to routine eye examinations. Again, I mentioned that earlier onset is observed younger ages in African Americans, sometimes occurring even up to a decade earlier than in white individuals. When diagnosed, African Americans are more likely to experience a more severe form of glaucoma with faster progression, leading to higher risk of blindness. There are different types of glaucoma. Primary open-angle glaucoma, POAG, is the most prevalent form of glaucoma in both populations, African Americans, white populations, but it has a particularly significant impact on African Americans. Again, research suggests that primary open-angle glaucoma is a genetic variant specific to African Americans or individuals of African descent. What other important information should I talk about? So older African Americans are not receiving, in many situations, potentially sight-saving care for open-angle glaucoma at the same rate as older white Americans. Again, it relates to a lot of the social determinants of health, lack of knowledge and awareness about the importance that everyone needs to have routine eye exams. You don't have to have any signs or symptoms. And eye loss, vision loss, may not be apparent until in later stages. What else? So glaucoma treatments for African Americans are the same as for other populations and include prescription eye drops, laser treatments, and surgery. The goal of treatment is to reduce the eye pressure to prevent vision loss. So specifically, treatments consist of prescription eye drops. Again, these eye drops, the goal is to lower the pressure in the eye and prevent optic nerve damage. There are options for laser treatment. It's a simple procedure that uses lasers to help the fluid drain from the eye, thus reducing the eye pressure. If other treatments don't work, surgery can be helpful in terms of helping the fluid drain from the eye. There's a new implant that releases medication continuously for up to 3 years. It's called the iDose TR implant. And to sum it all up, early testing can help diagnose glaucoma before symptoms appear. Regular eye exams are important, especially if you have a family history of glaucoma. Wearing eye protection can help prevent glaucoma caused by eye injuries. And other considerations, some people with glaucoma may need higher dosages of certain medications. Younger patients may not tolerate some medications as well as older patients. And people with advanced glaucoma may need to start laser surgery sooner than some other individuals. So basically, we have to individualize treatment therapy for glaucoma. African Americans, again, have a higher incidence of glaucoma than white Americans. And this is something that we all need to be aware of. Glaucoma is not something that is often talked about. It does run in my family, and I have to undergo routine examinations. On routine examination, I do know that defining the cup disc ratio in African Americans, sometimes there's a genetic variant where African Americans have a different cup disc ratio, and it may appear that African Americans have glaucoma, and therefore we have to oftentimes even have more routine eye exams. And again, the eye exams consist of the ophthalmologist dilating the eyes so they can get a look back at the optic nerve. So has to include dilatation of the eyes, not just a simple vision test. All right, I'll see you next time on Health Equity Briefs. Thank you for being with us. And again, like, spread this word, share this information broadly so others can benefit from these Health Equity Briefs. See you tomorrow.